I'm your student nurse today, Bella. We're going to be doing a head to toe on you. It should take 10 to 15 minutes. I'm just going to run through your systems. Can you tell me your name and your date of birth?
It's always Ferdinand, 8/22/04.
Okay, great. And do you have any allergies we should know about?
No.
Okay, so walking in, I can see that the patient is sat upright and relaxed. How are you feeling today?
Good.
Okay, patient seems calm. Do you know what day it is?
It is Wednesday.
Okay, and the date?
October 29th.
Okay, and where you are?
I'm in the clinic.
Okay, and what brought you in?
Just here for a well check.
Okay, patient is alert and orient times 4. Do you have any pain today?
No.
Okay, patient denies any pain. Do you have any tubes? I'm just going to look around. Okay, no tubes, lines or joints present. Patient's speech was clear, spoken complete sentences. Patient is well groomed and clean. So I'm going to be starting off with a head assessment. I can see that the patient's head is non-cephalic. Scalp is clean, intact and evenly distributed. Her hair. I'm moving on to her eyebrows and her lashes. They're evenly distributed. Her sclera is white. Her cornea is transparent. And I'm just going to pull down your eyes a little bit. And her conjunctiva is pink. I'm just going to do a quick eye assessment using this light on you. First, just look at me. Okay, pupils are at 4. I'm shine the light. Okay, and then just follow my pen. Okay, patient's eyes are equal, round, reactive to light, and they also accommodate. Moving on to the ears. I can see that there's no drainage in that one. No drainage in the ears. They're symmetrical and proportional to her head. Looking in the nose. Her nose is patent, no drainage either. Could you just open your mouth for me? Okay, mucus is moist, pink, tongue is midline, teeth were clean. We are going to move on to your neck. If you just tilt it to the side slightly. Same on the other side. Okay, no JVD is present, and I am just going to feel your carotid pulses. Okay, even bilaterally, forces 2. Next, I'm going to listen to your heart sounds. S1 and S2 were audible at all locations, no members were present. I'm just going to listen to a breathe on both sides of your neck. Okay. No brewery is present. I'm going to be doing your radial and your brachial pulse. If you just lay your hands out for me. Even bilaterally, forces 2 on the radials. Even bilaterally, and force is 2 on the brachials too. And next I'm going to do your pedial pulses. I'm also going to do your sensorium down there. So let's start with the pulse. Even bilaterally, forces 2 here. I'm going to do your cavity refills. cavity refill is less than 3 seconds. And if you just close your eyes, I'm going to do sharp, dull, sharp. Dull, 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 sharp, dull, 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 dull. Okay. And I am going to do your cavity refill on your hands too. Okay, and I'm going to do your sensorium too on your hands, so if you just leave them out like this, close your eyes. Sharp, 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 dull, 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 sharp, dull, sharp, dull. Okay, great. Okay, so moving on, we are going to be doing your respirations. So I can see that the patient's thoracic expansion is even bilaterally. Her AP diameter is 1 to 2. And you just take a deep breath for me. Her chest expansion is also symmetrical and even on both sides. I am going to listen to you. Have you had a productive cough recently? Produce this for you. Okay. Great, take a deep breath in and out. Breath sounds were clear, no adventurous sounds were heard. I'm going to do the same on the back. Take a deep breath in and out. Okay. Clear and no adventurous sounds were heard as well. So next you're just going to count your respirations. Just breathe normally for me. Respirations were 14. If you just take a couple of breaths for me. Patient breathes is equal, unlabored and effortless too. Next, we are going to move on to your abdomen. So if you just lay back for me. I'm going to ask you a couple questions to do with your bowel movement. So do you have a pattern? Do you have a pattern of bowel movements like morning, evening, night?
In the evening.
Is it regular, like every day?
Yeah, I'm
Okay.
every day.
And then, do you have any issues?
No.
And then for voiding, do you have any issues?
No.
And how often a day would you say you void, or how?
Every couple hours.
So first, I'm going to inspect. So I can see patient's abdomen is lighter than extremities. Contour is flat, no visible pulsations or visible movement. Next, I'm gonna listen to you. Bowel sounds were heard in all 4 quadrants. I'm going to palpate you next. Just let me know if you feel any pain. Abdomen was soft, no distension, no masses were felt. So assessing the patient's skin next, I can see that it is consistent with ethnicity. I'm just going to check edema. Okay, there is no edema, and I'm going to do the skin turgor next. Skin turgor is intact. I can see that there's no wounds, lesions, discoloration on the patient's skin. The temperature is warm too. So if you just sit back up on the side of the bed, we're going to test your range of motion and your strength. So if you could do this forwards and then do it backwards, and then go like this, and then roll your wrists. Do you have any pain? Okay, it seemed smooth. Range of motion was smooth. I had no crepitus. Patient didn't say they had any pain. We're going to do your neck. Go like this, like this, like this, like this. Pain? No. Okay. No pain. I didn't hear any crepitus either. And if you just shrug your shoulders up for me. Okay, great. So now we're going to do your strength on your arms too. So I'm going to push down and you push up. Okay, and then I'm going to push up and you push down. And then just squeeze my hands. Patient had no struggle with her strength, 5 out of 5. So we're going to do range of movement with your feet now. So if you just kick one foot up at a time, and then roll your ankles. Okay, and I'm going to do the strength on your extremities too. So same concept with your arms. So if you just lift your legs up, I'm going to push down, you push up, you push up, you push down, and I'm going to do it on your feet too. Okay, great. Range of motion, strength was 5 out of 5. Patients didn't seem to struggle with it. And then last question for you, do you have any hearing aids or glasses or anything like that you use?
I wear glasses and contacts.
Okay, great. Well, that is me done today. Here is your call light. And do you have any questions? Okay, well, thank you.